Do you sometimes feel like your heart is heavy, or like you can't enjoy things unless you're taking a certain medicine? Maybe you were injured and got painkillers, but now you feel like you need them just to feel normal. That might be a sign of something serious called opioid use disorder, or OUD. It's not just about using drugs. It's when your body and mind depend on opioids so much that it starts hurting your life. Think of it like being stuck in a cycle. You take the drug to feel okay, but over time, you need more just to feel the same, and stopping feels impossible. It can happen to anyone, even someone who started using medicine exactly as the doctor said. Opioids like oxycodone, heroin, or fentanyl change how your brain feels pain and pleasure. They flood your brain with a chemical called dopamine, which makes you feel good, really good. But after a while, your brain starts to rely on the drug to feel that way. Imagine eating your favorite candy every day. At first, one piece makes you happy. But after weeks, you need 5 pieces to feel the same joy. That's your brain adapting. Now, if you stop, you feel sick, cranky, or deeply sad. That's withdrawal. Genetics can play a role too. If addiction runs in your family, you might be more at risk. Trauma, stress, or mental health issues like depression can also make someone more likely to develop OUD. How do you know if someone or you might have opioid use disorder? Let's play a quick check-in. Have you ever taken more painkillers than your doctor told you to? Tried to stop but felt dizzy, nauseous, or anxious? Spent a lot of time thinking about getting or using the drug? Maybe missed work, school, or family events because of it? Continued using even after it caused problems? These are big red flags. Other signs include strong cravings, sleeping too much or too little, shallow breathing, or even passing out. It's not just physical. People often feel shame or try to hide their use. If you're wondering, is this me? You're not alone. And asking is the first brave step. Doctors don't use just one test to diagnose OUD. Instead, they talk to you, asking how often you use, how it affects your life, and if you've tried to quit. They might use a checklist from a guide called the DSM-5. For example, if you meet at least 2 of 11 signs like cravings, withdrawal, or loss of control in a year, it could be OUD. Treatment isn't about willpower, it's medical. Many people take medicines like methadone, buprenorphine, or naltrexone. These help reduce cravings and withdrawal, like a bridge to stability. Therapy is also key. Talking with a counselor helps you understand triggers and build healthier habits. Think of it like treating diabetes. You wouldn't just tell someone to stop being diabetic. OUD needs care, not judgment. Can OUD be prevented? Yes, and it starts with knowledge. Have you or someone you love been prescribed strong painkillers after surgery? Ask your doctor, is this an opioid? Are there safer options? Use exactly as prescribed and don't share meds. If you have leftover pills, return them to a pharmacy or use a drug deactivation bag. Schools and communities can teach about addiction in simple, real ways, like how even one pill can start a chain reaction. For those struggling with pain or stress, finding healthy coping tools like walking, talking, or meditation can reduce the urge to escape with drugs. Prevention isn't about fear, it's about empowerment. Scientists are making real progress. One exciting advance, at-home tests that quickly detect fentanyl in drugs, helping people avoid deadly overdoses. New medications are in trials that block opioid effects longer with fewer side effects. There's also growing use of digital therapy apps, like texting a counselor when you're craving drugs. Even more hope, vaccines are being tested that stop opioids from reaching the brain, so they can't give that high. Imagine a future where someone at risk could get a vaccine and break the cycle before it starts. These aren't sci-fi, they're real tools being tested now, giving new hope to families and communities.